Glad you're back with us, everyone. There's a big concern now, scrambling for staff. As coronavirus cases surge at area nursing homes, employee numbers are dwindling.
And these open positions have become increasingly difficult to fill. NBC 10's Tamara Sakarsik zeroed in on why.
Nursing homes have had staffing issues for years now, but this pandemic has only made matters worse. And now the industry says it's in the middle of a staffing crisis.
Every one of our nursing homes has open positions.
From Providence to North Providence to Tiverton, a quick internet search reveals hundreds of open positions at Rhode Island nursing homes, fueled by fear over the pandemic.
Some staff left. They were concerned about catching COVID and bringing it home to their families. They might have elderly parents that they care for at home or their children. We had some staff members retire early because, again, fear of getting the virus.
Federal data obtained by NBC 10 shows staffing shortages in Rhode Island have doubled in just the past 7 months. About 16% of nursing homes ranked below average for staffing in May. Now, 34% of facilities are facing staffing shortages. Just take a look at this graph. The red line represents shortages of nurses and CNAs in Rhode Island facilities. The purple line represents the national average.
It's a supply-demand issue. There's just really not enough people out there even applying for these jobs right now.
Westerly Health Center Administrator Jennifer Campbell says they've only had about a handful of COVID cases, but have seen about a dozen staff members leave in recent months.
Having them all leave in this short time period, because we're talking spring to right now in the fall, what has the impact of that been on the facility and the residents there?
It's really affected the way that we operate. There's a lot of expectations, and so now trying to get all of that done with the staff that you have, it's hard.
Facilities actually now need more employees than ever to avoid cross-contamination between units and lower the risk of spread.
In a perfect world, you'd have dedicated staff to every unit. But again, when you are limited, you're limited.
That has forced burned-out employees to pick up extra hours, something that Campbell worries will only get worse. With little financial incentive, vacancies are taking weeks to fill.
A lot of it has to do with the wage scales, I feel. You know, with the Medicaid reimbursement is not there for us in this industry, and it doesn't support the ability to really pay what these people should be paid for the work that they're doing. It's physically and emotionally demanding, and it's hard, and this isn't something that people want to go into right now.
Under the Medicaid Inflation Index, reimbursement rates are supposed to increase by 3% in 2021. The proposed state budget slashes that to just 1%, which Governor Raimondo continues to stand behind. In the studio, Tamara Sakarsik, NBC 10 News.